everybody, how are you? My name is Becca. I'm an author for the Dissociative Living blog on HealthyPlace. So I wrote a post recently about how to choose an effective DID therapist. And it got me thinking, once you've chosen that therapist, how can you feel safe with the therapist? And something came to mind that I wanted to share with you. The number one thing that can help make you feel safe with your therapist are boundaries. Is your therapist setting boundaries? Are they maintaining boundaries? Are they modeling boundaries? The boundaries between you and your therapist should be very clear and very appropriate. It is not acceptable for your therapist without permission to just even give you a pat on the back to console you, or just a little touching of the knee to make you feel better. All boundaries should be talked about. If you ever feel uncomfortable with something that your therapist is doing, you have the right to tell that therapist, stop, I'm not feeling comfortable with this. It is not your job to make the therapist feel okay. You need to communicate to your therapist that what they are doing is not all right if they are violating one of your boundaries. When I say this, I think about my own therapist who loves to shake hands with his clients at the beginning and end of sessions. Well, when I started seeing him 15 years ago, I did not want anything to do with that. I did not want male touch, and he respected that. And after knowing him for 15 years, I understand that he is a safe therapist, and I am okay in his presence. So sometimes I might even want a little hug. So we have an ongoing after-session agreement. So he'll say a hug, a handshake, or a fist bump today. And sometimes I'll choose the hug, sometimes I'll choose the fist bump, sometimes I'll choose nothing. But he always respects the boundary that I set. In fact, he even opens the door so that if we have any touch, even if it's just a handshake, nothing will look inappropriate. I'm also thinking too that when you set a boundary with your therapist, as far as like when you are done, when you are finished with your therapeutic session for the day, that while it's good for a therapist to challenge you a little bit, he or she should also respect when you have reached your threshold. Yesterday when I was in therapy, I had a complete switch in personalities and in my headmates. Now normally when I switch, I am co-conscious with my other headmates. But this was something completely that was jarring, that was disconcerting, and that was out of the norm. I'm not even sure at that point what was in the conversation. I just remember telling him, I've had enough. Just let me go. He listened to me and he recognized that I'd had enough, that I was at a point where I couldn't do anymore. And that's what a good therapist will do. They will set boundaries and they will support the boundaries that you set. So I hope that you have been successful in choosing an effective DID therapist, and I hope you maintain ways to stay safe in that therapeutic relationship. I would love to hear what you do to keep yourself safe in your sessions, so please leave a comment below. I love reading them, and I will be sure to check on yours. All right, that's it for now. Thank you so much.